So now we have type 1 diabetes. Now the type 1 diabetes is when there is no enough insulin in the blood. Now we have type 2. Type 2, this one is that there is enough insulin in blood. In fact, there can even be excess, but the problem there is that the cells are not responsive. They are not how like call it, yeah, they are not responsive to the action of this insulin. What I mean is, now the insulin is trying to drive sugar into the cells, but the cells are not receptive. They are not responding.
Can you tell us the causes what actually leads to these types of diabetes?
Well, like the first one I say, autoimmune. Yes, from birth, yeah, childhood. So now the other ones are like risk factors. We have hypertension as a risk factor, old age as a risk factor, alcohol, then also lifestyle, which is very primary risk factor. So your lifestyle, sedentary lifestyle, and a lifestyle where you do not do much exercise. Yes, you sit at home or you drive to use the elevator. You don't really move your body. You just eat and store. Yeah, your energy balance is really bad. Yeah, so lifestyle, then obesity too. You present yourself to the hospital and you present when you see these symptoms. So on top of the symptoms, polydipsia, polyphagia, and polyuria. Those are the 3 P's. Polyuria, that will be excessive urination. Polydipsia, excessive drinking of water that increase thirst. Then polyphagia is you are always eating that increased appetite. Then those are the 3 classic symptoms. Then you can also find.
Hello guys, once again welcome to Health Talk with Next Student on the Beast TV. So today we're talking about diabetes, the causes, complications, and not more. So stay tuned, don't go anywhere. So thank you once again for having me. It's a little level. What is diabetes?
Okay, diabetes is a medical condition that is characterized by persistent high blood sugar. Yeah,
Persistent high blood sugar. Please, can you throw light on that?
okay. Well, normally when you check your blood sugar and it reaches the normal level, yeah, whether it is fasting or random, yeah, you don't take one measurement and say, oh, I have diabetes. No, it has to be at different intervals. So now the keyword there is persistent. So whenever your blood sugar is checked, it has for you to make that confirmation that is diabetes, it has to be over a period of time. Yes, yeah. So that's the meaning of persistent. So you don't take one measurement and say, oh, I have diabetes, or your blood sugar can be high at just a particular point. So now a good example there is you finish eating rice and your blood sugar is checked. Obviously it will read high, but it doesn't mean that you have diabetes, because over time the insulin in your blood will drive that sugar into the cells and your blood sugar will no longer be high. It come back to the normal level. So you can say, so that's why it's defined as persistence.
Yeah. So am I permitted to say diabetes is high level of sugar than normal?
Yes, than the normal, yes, but persistent high level of, yes, to be persistent here.
So can you tell us diabetes have types, the types of diabetes?
Yes. Before I go to that, I'll talk on the causes, because the causes will let us know the types. Well, let me just mention the types. So now we have type 1 diabetes. Now the type 1 diabetes is when there is no enough insulin in the blood, and this is due to autoimmune destruction of the beta cells of the pancreas. Now what I'm saying is, this one, the body is not producing enough insulin. So I will say the cause now. The cause is unknown, but that's what is causing that autoimmune destruction. We do not know. I told you that autoimmune destruction is the body is trying to help itself, but at the same time destroying itself. So autoimmune reaction, the body that is the pancreas producing this insulin, the cells that are helping to produce this insulin gets destroyed. So there is no enough insulin to help to drive blood sugar in blood into the cells. So that is your type 1 diabetes.
the main function of that insulin is to actually drive sugar on your blood into cells.
Yes. So now if this insulin are not there enough, then that's where you now have diabetes. The sugar stays in the blood rod and their yes and increases and is high. So and what causes that is autoimmune destruction. Now the cause of this autoimmune destruction we do not yes learn. So that's for and it usually affects children and adolescents. Yeah. Now we have type 2. Type 2. This one is that there is enough insulin in blood. In fact, there can even be excess. But the problem there is that the cells are not responsive. They are not how I call it? Yeah, they are not responsive to the action of this insulin. What I mean is now the insulin is trying to drive sugar into the cells, but the cells are not receptive, they are not responding. So that's you see a problem. So the sugar now remains in the blood. So in type 1, that one there's not enough production of insulin, though the cells are receptive, they are responding. Now in type 2, there's enough insulin, but the body is not responding to the as the receptive cells yes are not responding to the insulin. Now the other type of diabetes is gestational diabetes. That one occurs in pregnancy. That one what just happens there is um due to the increased demand of sugar, yes, and insulin being produced in the blood, the body tends to become insulin resistant over time. So gestational diabetes leads to type 2 diabetes. So the body tends to become resistant over a period of time. So that is gestational diabetes. So we have type 1, type 2, gestational diabetes. Yes.
Can you tell us the causes what actually leads to these types of diabetes?
Well, like the first one, I say autoimmune. Yes, from birth, yeah, childhood. So now the other ones are like risk factors. We have hypertension as a risk factor, old age as a risk factor, alcohol, then also lifestyle, which is very primary risk factor. Your lifestyle, um, sedentary lifestyle, and a lifestyle where you do not do much exercise. Yes, you sit at home or you drive to use elevator. You don't really move your body. You just eat and you just eat and store. Yeah, your energy balance is really bad. Yeah, so lifestyle, then obesity too. So yeah, those are the risk factors for.
Is diabetes actually treated? Can it be cured?
No, it cannot. You can. It's a lifelong management. Yeah, you just manage it throughout your life, and which is actually are protecting yourself. Yeah.
So can you give us the ways you can actually manage it?
First, sorry, you present yourself to the hospital, and you present when you send these symptoms. So on top of the symptoms, polydipsia, polyphagia, and polyuria. Those are the 3 P's. Polyuria, that would be excessive urination. Polydipsia, excessive drinking of water that increase thirst. Then polyphagia is you are always eating. You're always eating. You're always eating. That increased appetite. Then those are the 3 classic symptoms. Then you can also find weight loss. Yes, there'll be weight loss. It can also be blurry vision. So those are if you experience those symptoms, then you present to the hospital. That's where the management can begin. Your history have to be taken. No, now from the history, the doctor can make a diagnosis or whether it is. Though we can do some investigations, but why I'm saying this is because well, what you might feel it is diabetes, you can go and see it is something else. So that's why we present to the hospital. Now the investigation that can be done still is under the management is your fasting blood sugar. Your fasting blood sugar can be taken, your random sugar can be taken, and your HbA1c. So those are the investigations that can be done. Then from there, if the diagnosis has been made that okay, it is diabetes, you can now start your medications based on what they prescribe. Oh yes, you can start your medications. So now in medications aside, awareness is very important. So some meat has to be like cancelled because people will tell you don't you have diabetes, don't take anything carbohydrate, stop eating rice. don't eat yam, those or why they say if you start taking insulin, it's over for you. And mind you, insulin is only given to people with type 1 because there's decreased production of insulin. You cannot give insulin to someone that has type 2, which is insulin resistance. Your cells are resistant to anything insulin wants to do. So yes, you don't give. So now for someone that having type 1, it will be like, yeah, oh, you are done for. Yeah, so it's not that way. So those are the management. Yeah.
You mentioned something. You mentioned weight loss and then excessive intake of water and excessive intake of food.
Okay.
So why is it that you're eating and also you're losing weight?
That's one. Well, okay, yes, I remember I mentioned that there is increased level of sugar in blood. Now that sugar is your energy. Now let's say you've eaten rice, and this rice, the energy, or rather, instead of it being driven into the cells so that the cells can continue its function, it remains in blood. Your body feels that it hasn't eaten. Your body still feels hungry. Your cells are not satisfied, so it is still triggering that desire for food. So you keep on eating, but the food is just the energy that's being gotten from the food just remains in the blood. Doesn't get to the cells. So that's why you are constantly eating. You are constantly eating, and yeah,
So those are the main symptoms of that. Those are the things. Excessive urination,
yes,
excessive intake of water, excessive eating, weight loss. You also mentioned that blood behavior. Yeah. So can you tell us the complications?
okay, good.
Of bad.
As you even mentioned that blurry vision, it's a later sign. So that's a complication. So later on, that's what we start feeling.
This diabetes actually.
Yes, if you do not manage diabetes and the condition, so over time, what happens is the high level of sugar in your blood. Now, there's something they call lazy white blood cells. Now, when you have an injury on your leg, what your body does is your body sends blood to that area so that your white blood cells are in that blood. So it goes to that area to go and heal that infection. Something that should take, let's just say, 1 to 2 days for your white blood cells to reach that area to heal that infection that might want to arise from that wound because it's an open wound. For a diabetic patient, it will take several weeks to months. That's why you see that for a diabetic patient, wound delay to heal because it causes lazy white blood cell. Now, the lazy white blood cell, why the white blood cell is trying to move through the blood to go to that area where it's infected, there's a lot of sugar in the blood, so it makes movement difficult. Yes, so imagine an ambulance trying to move through a traffic. You see, the many cars, so imagine the cars that the sugar, so it's finding difficult to get to that location where that injury is. The sugar alone, the destruction it causes to the blood vessels, it ruptures the blood vessels. That's where the hypertension comes in. It ruptures the blood vessels. It ruptures like the blood vessels that leads to the eye too can get compressed by this sugar. So you start having that blurry vision. The blood vessels that go to the kidney, so it can cause what we call diabetic reticulopathy. That's your retina can be affected. That's your eye. It can cause diabetic nephropathy. Your kidneys are affected. So
diabetes can actually lead so much
yes, your organs can start failing. Your organs can start being destroyed by this high level of sugar. Yes, so the sugar compresses the nerves, so you start having tingling sensation on your foot. Yeah, they can cause numbness. That's why diabetic patients can be walking and their slippers comes out and they do not know. They keep on walking. Yes, diabetic patient can feel coldness on the feet. And some of the stories it can tell you is my feet were cold and I now set fire and I kept my leg on top. So because of they are feeling numb, they don't feel the pain. Their feet can start getting burnt, but they won't know. Someone can tell them, or they might perceive something smelling like a barbecue, and that's when they know. So diabetes is as dangerous as, so those are the complications. So it's something you handle immediately, and you don't handle it and stop. You don't use herbal medications. So one problem with herbal medications is that we don't know how they work. We don't know the quantity we are supposed to take and all those stuff. They might actually add more to it. Yes, but you don't know. So herbal medications are not the solution. Using your medication and stopping halfway is not the solution. So we just constantly, and what will it cost you? You're trying to protect yourself. So yeah, you try, you get your management quickly.
Can you tell us the lifestyle management, how we can manage good resistant diabetes?
So now exercise. But I won't just say exercise. Then you need something or someone to motivate you, not just you. Because for people who don't feel like they still feel active, they feel that before they can get into something physical, it has to be a problem or a condition that keeps them to the floor. Diabetes can still make you go about your daily life strong, but it's also like a silent killer, like hypertension. Though hypertension is more silent, for diabetes you can be seeing the symptoms, early. But what I'm saying is, for someone who is diabetic, it's not shown on the body. You can't be lying down, you can be studying. So make use of the opportunity and try. Okay, you take more walks in the morning. It's not every time you use the elevator, at your workplace. If your workplace is not too far, you can just take a walk there, maybe in the morning. Either you order an Uber coming back, or maybe if you already have a car, someone can come and pick you back up. You don't always have to use a car. You go home, you lie down, you wake up, you just eat, no form of exercise. And so your lifestyle modifications can just be routine exercise that you made up yourself. Then avoid things that, try to like maybe use a staircase more often. You see, so those are lifestyle related modifications. Then your feeding too, your food, your diet, you can reduce on the starch food, or carbohydrate food. Not like you stop them completely like people say. And also the timing at which you eat this food, you don't eat it very late at night and go to bed. Already you are conserving energy when you sleep. So why take carbohydrates that's when you are going to bed? You can take it in the morning before leaving, because you are going to expend energy talking to people, brain work, which usually large percent of vehicles when you are going for work. Type calculations, you guys student. You see, so yeah, you take it more in the morning or going out, then less at night. And also in the morning try to eat maybe later on, like 10, 11. Why? Because already when you wake up in the morning, your body feels that you need energy, so it sends enough energy into the body. Okay. You see, so now way to carry out the daily activities. So that's the very natural way the body works. So you don't necessarily need to go and rush and take in food. But I know nobody is going to follow that anyway. You're already having in the morning. So yeah, you do that.
So, please, can you tell people out there who are struggling with diabetes, can you just give them a word of advice?
Okay, diabetes is not the end of everything. Already if you're started having symptoms, just present to the hospital for management. Then as for people who haven't had it yet, like let's just say young people out there, you don't feel that it's a disease of the old. Yes, you start from athletic prevent. Yes, start around to manage your lifestyle. Like I say, you try to go for runs in the morning. You try to eat healthy. Yes, and yeah, you will be fine. It's really something you can manage. It's not like if you manage it, you still have it. No, and even if you have it, it will end you. You live a life like a normal person who doesn't even have it. So that is just the advice.
No, thank you very much. I really love this topic. And please, if you have not subscribed, subscribe for more videos like this, like and share for others to learn. Thank you.